behind on payments to their health workers, but the county say they're short of 125 billion. The last time I listened to the president of COG, she said the last time they received the allocations from the national government was December. I saw the Mombasa governor Abdul Samad Sharif Nasir, when he was hosting the deputy president in Mombasa, say ilibidi wabambanye waombe they borrow to pay their health workers. So this is a situation where if to understand the governors correctly, the shoe is pinching for everyone. So what do you expect in such a situation? But nitakuja hapo. Dr. Bethwel, where are you employed?
Thank you, Olive. On this panel, I represent pharmacists, and I'm also a face of the unemployed doctors. So currently, I'm not attached anywhere.
You're not attached anywhere?
Yes.
How has that come about? After how many years of training?
After, I'll say 6 years of training, 7 actually, because I did my undergrad for 6 years, and then there's 1 year mandatory internship. So those are 7 years. And I graduated in 2019. So I've been out doing 1 or 2 things, which are not necessarily related to my training. So that came about, of course, after health was devolved and the functions were devolved as well. So it meant then that after the 1 year mandatory internship, which was being conducted or being supervised by the national government, then it meant healthcare workers, especially the doctors, that is the pharmacists, medical officers and dentists, were to seek employment from the county government. And it hasn't been an easy path because it comes with its own set of bureaucracies. Looking at pharmacies specifically, there are counties that have gone 2-3 years without advertising any position for pharmacists. And yet we understand that, the importance of this set of professionals in the healthcare system. We've been trained to ensure that the medicines that you use, the medicine that the public use, are safe, efficacious, and that they are of good quality. But what happens if we have understaffing in that particular area? It means the few professionals that have been employed, they'll experience burnout, and number 2, they are converted to be conveyor belts of dishing out medicines instead of offering pharmaceutical care. So you end up having medication injuries, the public having medication injuries, which of course is the 4th leading cause of death worldwide. So it's not only the issue of unemployment, but it cuts across to the safety of the public, the well-being of the public. And it's unfortunate that the government looks at healthcare as an expenditure as opposed to investment. If I contrast that with education, the government looks at education as an investment, and that's why perhaps they put a budget of around 550 billion for TSC. But when it comes to healthcare, it's 4% of the annual budget. That's around 120 billion. We're looking at the unemployed doctors. We're around 4,000 of us. If we calculate how much the government will spend annually for an entry-level job for a doctor, which is the job group M, is around 12 billion annually. So we sit back and ask ourselves this question. So is it lack of political goodwill, or is it designed that the public healthcare system fails? Because it doesn't add up if 30 billion can be assigned for a dam project, and yet we need people healthy, we need the public to be healthy. You're not employing doctors, and yet you're assigning money for projects. And maybe picking up from what Dr. Miskela shared, about civil servants and the pain of delay salaries. I may not have the experience to talk about it, but of course there are those people who have gone for the internship, the 12-month mandatory internship, and their salaries have been delayed by almost 3 months. So I'm wondering, how are they surviving? You're just out of school, you don't have any savings that can act as buffer. You're expected to be at your station at least 40 hours a week. Others do more than 40 hours because the facilities are understaffed and they're depending on interns to fill that gap. So how are they managing it? Because there are bills to be paid. How are they managing it? You are locked up in a facility Monday to Saturday, or 7 days in some situations, and yet you're expected to pay your bill at the end of the month. And of course, now that explains why most of the young, we have cases of young doctors committing suicide. It's because of frustrations that come as a result of that, which is quite unfortunate. That is the situation that we are facing.
How long have you been tarmacking?
I'll say, of course, after my training, I got my license in 2021, May 2021. And of course, after that, tried a few businesses here and there. Things didn't work out because of COVID was there. There was strain in the economy. And so I hung my lab coat April last year. So I hung my lab coat April last year and began freelancing, that is doing writing and digital marketing. Of course, that is not what I trained for 6 years in school, but now circumstances forced me in that direction. Yes.
All right. Dr. Miskela, there's a question that is pending. Counties, so first of all, a status update. How many counties still have not paid the healthcare workers? And number two, counties say they haven't received money since December, so the shoe is pinching for everybody.